Dear Health Minister, my name is Dr. Gordon Reid. I am a board-certified clinical psychologist who has been in private practice for more than 30 years here in Vancouver. I currently head a team of 7 other board-certified PhD-level psychologists who between us have over 180 years of clinical experience. In addition, on our training team, we have a medical oncologist who has been providing ongoing support and teaching to us in her specialty area of palliative care with cancer patients. Over a year ago, we began working on and implementing a training package for working with cancer patients suffering from existential anxiety and despair with the intent to use psilocybin combined with psychotherapy as the primary treatment. As you are well aware, there is a legal requirement that in order for us to use psilocybin in our training programs, Health Canada needs to grant us a Section 56 exemption for this purpose. And of course, the same Section 56 exemption is required for the patients who could then become legally eligible to receive such treatment. Since, as of this time, we have not received the Section 56 exemptions, we are therefore not able to complete our training, in spite of the dedicated effort and goodwill that we have demonstrated in this regard. I would like to clarify that we are not eagerly and excitedly waiting to undergo this psychedelic treatment, but rather are willing to undergo it as we see it as a very important requirement to help us better understand the experience of the patients who would receive a similar treatment, thus allowing us to be more helpful for them and more capable of minimizing harm. I would like to be very clear that I am providing this video here today because it is obvious to me that the floodgates are overflowing with both patients who are seeking treatment and people who are willing to provide it. But it is also clear to me that making it legally impossible for licensed therapists such as ourselves and others who are currently receiving training with Therapsil to complete this process is only ensuring that underground therapists are going to take over this arena. I am very concerned about the possibility of harm in what is increasingly becoming an unregulated field with very powerful medicines. Specifically, it is our intention as regulated and licensed professionals to not only become psychedelic therapists, but to provide the subsequent training to others who are interested in doing so, such that we will establish and update the most relevant protocols for this treatment, continue to critically follow the research results, and ensure the highest standard of treatment and care. With regards to the patients, it is difficult to imagine a more difficult process for these different patients to require them or their caretakers to navigate an unfamiliar and complex labyrinth involved in this application process. Patients who are already struggling to make sense of their own existential crisis and are already preoccupied with an overwhelming number of treatment decisions and life challenges. Surely we can do better for them. This treatment is certainly not without its risks, but when done in an unregulated manner with people who have received insufficient training, these risks rise exponentially. In this regard, I applaud your thoughtfulness in defining the proper regulation of this treatment. We accept that it is a correct position to be cautious with these medicines and their introduction into the social medical system. We believe we are more than capable of providing an appropriate safety net. We are seeking to establish safe and regulated control mechanisms to ensure the safety and well-being of these patients, and we are hopeful that you will listen. The genie is out of the bottle, and it is not going back in. We, in alliance with Therapsil and on behalf of others who have been selected to receive this training, are offering a process to contain it properly with trained and experienced professionals. If not granted to professionals such as ourselves, then who? Through inaction, this will flood into an unregulated landscape. I submit this video to you respectfully and encourage you to consider not only providing Section 56 exemptions for the patients and the training teams, but to look more carefully at this entire application process to see if there's something that can be done to make it more efficient and easier to access. I thank you for taking the time to watch and listen.